Welcome to the HDOH VFC Virtual Office Hours this Tuesday, August 20, 2024. My name is Lorraine Lim, and I'm one of the VFC Quality Assurance Assessors. For housekeeping today, QA team, please ensure you're muted throughout the presentation unless you are speaking, and please monitor the chat for questions. For attendees, today's session is being recorded, and slides and webinar recording will be uploaded to the VFC website. And to be added to the Hawaii VFC program email list, please email your request to hawaiivfc@doh.hawaii.gov with email list in the subject line. During today's webinar, please use the chat to ask your questions so the Hawaii VFC program subject matter experts can respond directly, and all questions will be answered at the end of today's presentation. Let me turn you over to our presenter today, Kealohi Corpus.
Hi, good morning. So the objectives of today's webinar will be providers should be able to retrieve their digital data logger data from their temperature monitoring system. Providers should know how to read and interpret that data, and then they should be able to know what needs to be submitted to the Hawaii Department of Health VFC program for monthly submissions, temperature excursions, etc. Next slide, please. So first, we just want to start off talking about what DDL data is. DDL stands for your digital data logger. This is the temperature monitor that is required by the VFC program. And the data that comes from the DDL should be a comprehensive data set that shows the minimum and maximum temperatures logged by that monitor each day for at least 1 month. And it should also include any alarms that may be triggered due to temperature excursions or other issues with the monitor. It can also include the time the alarm was triggered and the duration of each excursion event. Supplemental graphs can also be utilized to interpret your DDL data, but that's depending on the system you use. DDL data gives us a deeper look into the temperature history and the stability of a VFC vaccine storage unit, and it is especially useful to monitor temperatures when staff are not in office. Next slide, please. There are a few times when it's necessary for you to be downloading your DDL data. For the most part, it should be routinely every 2 weeks, as this is a requirement of the VFC program. You would have to download your DDL data in the event of an excursion or an alarm is triggered. And you should download your data after the office or facility is closed for a period of time other than routine closures. For example, your office is closed for a long weekend, there's a school break, or your office took a day off that wasn't anticipated. You may also be asked to download your DDL data by a member of the Hawaii Department of Health VFC program team, so that's also a possibility. Next slide, please. So our VFC providers here in Hawaii use a number of different temperature monitoring systems. For the most part, most providers use the Berlinger Fridge-Tag DDL, which is often provided to you by the program here in Hawaii. Some of our bigger systems use SensoScientific or AccuVax and AccuShelf. We would like to note that the built-in unit thermometers are never and not permitted for use for daily monitoring, as they don't meet all the VFC program DDL requirements. Next slide, please. First, we're going to go over the Berlinger Fridge-Tag DDL monitor. Next slide. This is the most common DDL monitor amongst our population here in Hawaii. And to retrieve this data, it's fairly simple. You're going to detach the monitor from your storage unit. There is a USB plug that pops out from the top of the DDL, and that's going to go into the USB port on your computer or laptop. You're going to go ahead and open the Fridge-Tag device as it pops up on your computer, and go ahead and open the PDF. as seen in the pictures to the side. For some of our users, the current Adobe PDF program, depending on which one you have, won't support the Fridge-Tag PDF file. If this occurs, you're going to have to go ahead and open the file using another app, such as a browser like Microsoft Edge or Firefox. We would also like to caution our providers that sometimes the work computers have a safeguard that don't allow you to just plug in any USB to your device. So in the event that this happens, you're gonna have to reach out to your IT or systems for your facility to get that taken care of, because it's pretty essential to be able to just plug in your DDL when you need to, bearing any kind of excursions. Next slide, please. For temperature excursions that pop up on the Fridge-Tag, if it's found on your monthly log, a member of the QA team is going to request that you download your data. However, there are situations where VFC providers should self-report any excursions that they notice on their data, and it should be reported as soon as they occur to prevent any kind of vaccine order delays or holds. Delayed reporting of a temperature excursion and the subsequent clearing of that effective vaccine by the VFC program can potentially run the risk of the viability of the vaccines given to your VFC eligible children population. We don't ever want to have to backtrack for an excursion that happened months ago and you have been administering vaccine to children in that meantime. So if an excursion is found, providers are going to have to download their data, analyze it for any out-of-range temperatures, and submit the data to the VFC program. If it is a situation where you have to do a full follow-up, you will have to complete the temperature excursion protocol, which includes troubleshooting issues with the unit. You're going to have to contact the manufacturers to get viability clearance for each vaccine, and then you're going to have to then submit 5 days of stable DDL data from the most recent excursion that occurred in that specific unit. The example here on the right, this data shows us that a VFC provider's freezer had an alarm. Actually, it had multiple alarms, and it was triggered on 7/9 and 7/10. You can see that the temperatures are clearly out of the appropriate range of -15 to -50 degrees Celsius. Therefore, it did require proper follow-up, and the full excursion process needed to be conducted. Next slide, please. For our provider to use the Fridge-Tag, the monthly temperature submission should be the manual temperature log that is provided to you by the Hawaii Department of Health VFC program, or another form of temperature log that's already been pre-approved by our team. Manual log should include the initial of the staff who's doing the daily workday temperature check. It should include the time for the morning and the afternoon check. There should be at least one minimum and maximum reading per workday, which is typically taken at the beginning of the workday. And then there should be 2 current temperature readings each workday. We do want to note that we know that our temperature logs say that you should put an X in the box where the manual or the current temperatures go, but we have now changed that directive to have our providers write the actual temperature there. Next slide, please. Moving on to the SensoScientific DDL monitor. This is a bit more of a complex system. It offers our providers an opportunity to use Bluetooth capabilities to receive alerts about any kind of issue that's going on with their unit. But in order to retrieve that DDL data from this system, providers have to go into their online Senso accounts. Under reports, you can select a number of different reports for your units. However, the ones that we accept for DDL data here at the Hawaii Department of Health would be either the monthly report, the graph report, or the daily or weekly report, depending on if we request that from you. Next slide, please. Temperature excursions for providers who use Senso is a little bit different than Fridge-Tag. If an excursion is found on your monthly log submission, which should be your audit node report, you will receive a request from a member of our team for your DDL data or your data graph, so that we can further investigate the nature, or even if it is a real excursion, oftentimes the audit nodes will log temperatures that are not accurate. For whatever reason, that's how the system is, but we'll get into that a little bit later. The DDL data or the graph gives our team a better look at your VFC vaccine storage unit and whether or not it's maintaining appropriate temperatures. The DDL data should be, like I said before, either in the form of a weekly or monthly report, which is generated by the system. And just to provide further information, you can also submit a graph. We will always take more data as opposed to not getting any data at all. So please feel free to submit anything that you're able to retrieve for us. The good thing about SensoScientific that it alerts its users about any excursion of events when it actually occurs. So even if you guys aren't in office, those who have access to the alert will get one, and it will, they can alert the necessary staff who need to address it. For users who receive those kinds of alerts for excursions, need to immediately notify the Hawaii Department of Health QA team. And then we're going to go ahead and decide whether the excursion process needs to take place. In certain situations, the full process may not be necessary, depending on the duration, the severity, and the condition of your unit. Again, delayed reporting of temperature excursions and then the clearing of the vaccine by our team is very important, that you report them as they come. Any kind of delays can potentially run the risk of the viability of the vaccine given out to the children that we're targeting here with our program. And then following an excursion event, the providers who use Senso will still need to submit at least 5 days of stable data so that we can go ahead and clear the unit and also clear the vaccine for use and restore any kind of place following the excursion. I did want to get back to the audit node reporting. The audit node reports often will report out of range temperatures from past excursions that occurred but were never cleared by that specific user. In the event that this happens, please also attach your monthly report with your monthly submission, just to kind of expedite any kind of order that you may have put in. Otherwise, we will have to go through the process of emailing you for that DDL data to clear whatever kind of out of range temperature might have occurred on your audit node report. Here's an example that I pulled from one of our providers. The top is the audit node report, which will show the staff member who ran the audit, the unit. It goes min, max, current temperature, that's the order. And then the 5/18 date is the prior audit date that this user logged in to do an audit. And then the 5/25 is the current audit date. As you can see, a 16.2 degrees Celsius temperature was logged that day. However, when they did submit their monthly temperature report, which is synonymous to DDL data, on that same day, it did not have that 16.2 degree Celsius temperature, which means that it's not a true excursion. Rather, it was probably an excursion that occurred on the 18th that was never cleared by the user. So we just want our providers to be mindful of these out of range temperatures that might be logged, and just to kind of get ahead of it, to submit the monthly report DDL data with your logs. Next slide, please. So here's an excursion example that you might see for a SensoScientific user. The DDL data here shows us that there were 2 separate excursions that occurred in this specific unit in March, both on the 28th and the 25th. The appropriate temperature range for this unit should be 36 to 46 degrees Fahrenheit. And as you can see, the highlighted temperatures, there was a small spike on the 28th, which was 46.8, but the bigger spike that happened on the 25th, the 49.1 degrees Fahrenheit, let us know that a full excursion process needed to take place, just because there was 2 instances within a 4-day time span. And that required further investigation. So this provider did have to complete the full temperature excursion process and submit the necessary documentation. Next slide, please. The monthly temperature submission for SensoScientific users is a little different. There are 2 options for these users. You can either submit your audit node reports, but that has to mean that you have full online cloud use of the unit, of the system. It should include the name of the staff who audited the unit each workday, the min, max, and current temperature of the vaccine unit that was audited, and then also the time and date of the audit. The example here on the right shows what a full audit node report should look like, and this is suitable for a monthly temperature log submission. However, there is another option for our Senso users. Oftentimes, not all staff members in a facility or clinic have access to the online system, which makes it a little bit harder to get online and run an audit every day. So if something like this is happening in your clinic, you can submit the Hawaii Department of Health VFC manual temperature log, but we ask that you also attach the monthly report, the DDL data, just to kind of help back up any irregularities that might show up. If Senso users opt to continue using the manual log, they must reset the min-max each time a daily temperature is recording on the physical monitor on the unit. This monitor will not update by itself if an excursion occurs. It's likely that it will stay that way unless it's reset each day. If staff don't reset the digital display each time, an inaccurate repeated temperature will occur, and we'll see that on your manual log where the temperature is the same every single day. No matter how stable a VFC unit might be, there is always temperature fluctuations, so that kind of indicates to us that something is going on. Here on the side, you're going to see some instructions. If you don't know how to reset the unit, you're going to follow the instructions there. Next slide, please. One of the other big temperature monitoring systems that the Hawaii VFC providers use is AccuVax or AccuShelf. Next slide, please. So how to retrieve your data from your AccuVax or AccuShelf system. Users have access to AccuSite, which is the online portal. You're going to go ahead and log in under the temperature tab. Users are able to access the comprehensive temperature data for each unit. AccuVax or AccuShelf allows users to generate detailed reports for temperature data. Users can adjust the parameters for each report based on the unit section, the time interval, and the date range they want to gather data from. You can see on the side here, under that temperature tab, you're able to run different reports. The detailed temperature reading is where you'll access your temperature excursion data if you ever need to look into it and get a more comprehensive look at how your unit is faring. Another good thing about this system is it also uses a Bluetooth system, so users are able to get alerts even if they're not in clinic, which helps in addressing any kind of irregularities in the temperature quicker. And it can help, and it can allow you to alert our program here quicker to temperature excursions as well. Next slide, please. Temperature excursions for AccuVax or AccuShelf users. There is an automated system, like I said, that notifies you of excursions In the event that an alarm is triggered, providers should access their DDL data via AccuSite and evaluate the details of the event. All temperature excursions should be reported promptly as they occur. Like I've been saying, it's very important to not delay the reporting of temperature excursions. The viability of the vaccine is the most important thing here, and we want to make sure that the vaccine that are going out to the VFC population are viable and they're good for our keiki. The DDL data should be submitted to the VFC program here, and it is a program requirement, of course, for any excursion that may occur. Should the excursion require thorough follow-up, VFC providers are required to complete that entire process. Just like any other temperature monitoring user, AccuVax or AccuShelf users have to submit 5 days of stable data in order to show us that the unit has stabilized since the last excursion occurred. Here on the right, you're going to see an example of an excursion that was found in an AccuVax. You can see here that the max temperature was 12.4. Actually, it was the min that day was 11.2 degrees Celsius. The max was 18.5. I apologize about that. And that occurred on 4/11. This was well out of the appropriate range for fridge units, which is 2 to 8 degrees Celsius, which meant that the full excursion process needed to occur. And the necessary documentation needed to be submitted to our team here. Next slide, please. Monthly temperature submissions for AccuVax or AccuShelf users should look like the example here on the side. You can access this monthly report via AccuSite. If your VFC provider PIN or facility name is not clearly distinguished on your report, there is a little section on the report that has the location name, but because a lot of our locations are near each other, or they all have the same org, it's hard to sometimes discern which location is sending the logs. We ask that you please add in a text box somewhere your provider PIN. Next slide, please. Just some DDL monitor reminders. Next slide. DDL should be utilized on each VFC vaccine storage unit and transport unit, whether it be for emergency or non-emergency. Providers should only utilize one digital data logger system to prevent any kind of confusion between the temperatures. Providers who opt to use the Berlinger for daily monitoring and other Bluetooth or wireless systems as a backup should know that if an excursion occurs on either system, a follow-up is going to be required regardless of whether or not an excursion showed up on one or the other. All DDLs require certificates of calibration. The typical duration for calibration is roughly around 2 years. So if you know that your DDL is set to expire, you should reach out to your system manufacturer to request recalibration prior to it actually expiring. DDLs that have expired calibrations will often report inaccurate temperatures, but if it does have an excursion and it's an expired DDL, it still will require follow-up. For our VFC providers here in Hawaii who use the Berlinger Fridge-Tag DDL, before you purchase, you can go ahead and reach out to our QA team to see if we have any replacement availability for you folks. However, that is contingent on funding. We do want to remind you that prior to purchasing a new DDL, providers should clear the DDL with our team to ensure that it meets all necessary VFC program requirements. We want to make sure that it's suitable for use before you go ahead and make that purchase and end up having to return it, or if you can't return it, that's going to be lost to you. Providers should ensure that at the very least, the primary and backup VFC coordinators are well trained in the temperature monitoring system that you've chosen. However, it is our strongest recommendation that all the staff who store and handle VFC vaccines should be trained in proper temperature monitoring protocols or procedures applicable to your facility. Next slide, please. Just a couple more reminders. The probes for your DDL should be placed centrally within your storage unit, just to ensure that there's accurate vaccine temperature readings coming through. We want to get a good idea of how the vaccine are faring in your unit. So we ask that your probe not be pushed up against the back or to the side or lost somewhere in your unit. And finally, all DDL, like any other VFC related document, should be kept for a minimum of 3 years as per the VFC program record retention requirement, but that can be either digitally or paper copies. Next slide, please. If you guys have any questions regarding HIR, you can go ahead and reach out to our registry help desk at the numbers there, or you can go ahead and shoot them an email. For general questions about immunization, you can call our main line here. For VFC specific questions, you can reach out to any member of our QA team listed there, or for specific vaccine order questions, you can also reach out to our vaccine ordering team. Next slide. We do want to thank you for joining us today for our webinar. This will be uploaded to our website soon. We ask that you please complete the satisfaction survey just so we can get a kind of idea of what other topics you might want to hear about from our team. And if there's any questions, we'll take them now. Otherwise, we thank you for joining us.
Today's session will be posted in our VFC website under Education Opportunities. So I posted the link in the chat, as well as the link to our VFC office hour satisfaction survey. In the survey, we ask that you let us know what other topics you want us to talk about, and if you have a preferred date or time and how we could improve, we would really appreciate it. Anybody have any questions before we conclude today's session? If there's none, we want to thank you all for joining us today, and we hope that you enjoy the rest of your day.